I'm here to tell you why you should never, ever discharge your patients. And here's why. You ever had a challenge with your car and your tires are squeaky, right? You're having, it's making a funny sound every time you push the pedal, whatever it is. And you take it to a mechanic, all right? If you're the consumer, you take it to the mechanic. The mechanic says, oh, these fancy terms, it's the rotors, blah, blah, blah. And they say, oh, I can fix that. You're like, oh, awesome, you have a solution. That's beautiful. So they go in, they fix it, and while they're working on the car, they bring you over and say, hey, here's the main problem, and I'm gonna show you how to fix it yourself. And you're like, the consumer, you're like, oh, that sounds great. So they say, hey, you gotta tighten this up, move this over here, do this, and that. And they send you on your way, and they're like, hey, don't worry, don't ever call me again. Don't ever ask me for help on these brakes again, because now you have the tools to do it yourself, Mr. Consumer. And you as a consumer, you're like, okay, but I'm not a mechanic, and I didn't plan to go to mechanic school. It's just easier if you help me. And as a consumer, your job is to get like your things fixed. And the problem with sports physical therapists is that you are the mechanic. You are the person fixing somebody's problem. And your goal is always to make people independent and fix their own problems. But what if people don't want that same problem to be fixed on their own? What if they need the accountability? What if they need the motivation? What if they need the education on it's a different type of a tire, a different problem that's a little squeaky? And as a physical therapist, when you discharge somebody, what you have to understand is you're telling them, don't worry, you can now fix your own tire by yourself because you did it this one time. Now you can do it on your own forever and beyond. I don't think that's possible. When you think of car mechanics, they go to school for a long period of time. They worked on thousands of cars. They made it seem so simple because they had all the solutions, all the skills, all the tools to make it happen. And as a physical therapist, you forget that you've gone to school, you have all this extensive training, and just because you can solve one problem, it was patellar tendonitis. What happens when it's a knee meniscus or an IT band problem or an ACL or an MCL? That consumer doesn't know any better. So when they try to apply the same tools that you taught them for this one thing, now it creates different problems elsewhere. And as a clinician, independence is a fantastic thing, and it's for the right person. However, there's a large number of patients out there who don't want to do it on their own. And once you get them fixed and you say, you don't need to come back to me, there's people who won't come back to you because they're embarrassed. That you said you should be independent, you have all the tools, and they feel embarrassed to come back and say, I don't know how to do this one. And so what happens, you lose patients, you lose people. So instead of discharging them, let them know that they have the option and opportunity to come back to you if you have any questions, any challenges, or if it flares up or something different happens. Because if you were getting your tire fixed by a mechanic and they said, you're independent, but they said, listen, if that's squeaky again, come back in 2 weeks. Or if it makes this sound, it might be something different, so you might have to come back. What you're doing is allowing them different options. The consumer doesn't know any better, and the more freedom and wiggle room that you can communicate, there's gonna be challenges along that path, but you can always come back with questions. I can always take a look at it and give you that. That creates a better relationship with your patients and athletes. Now you have athletes who trust you and know they can always come back. But when you say, don't worry, you're discharged and you're independent, you no longer need me, you're disconnecting yourself, you're disconnecting relationships, and you're saying, don't worry, you figured it out on your own. Even though it's taken me 7 years to become a clinician, I know in these 4 visits, you're now an expert. And you and I know that's not true at all. And I think you have to take it from the consumer side and understand they're coming to you with squeaky brakes and you're telling them, don't worry, they can fix it on their own. It's not possible. So next time you're discharging a patient, instead of letting them go, give them options. Let them know, here's the different things that can come up, but I'm here to help at any given time. So don't discharge them, give them options. If you're a sports physical therapist and you're looking to help put all of these pieces together, be more successful in your clinical practice, get more athletes on your schedule, and be the successful sports PT that you've always dreamed of, you need to register for my 8-week online mentorship program called the Sports PT Kickstarter, where I'll help you figure out what it is in your clinical practice that you're missing, give you the highlights of what it is to be a sports PT in all domains, whether that's on the field coverage, strength and conditioning programs, injury prevention programs, or sports rehab. I'm excited to see you inside the course.